Action Health is actually a non-profit organization primarily dedicated to promoting adolescent sexual and reproductive health. Our work covers advocacy, community outreach, and service provision for young people, and we work nationally. Our primary entry road into work with young people is creating access to sexuality education and youth-friendly services. And in the course of trying to do that, we have to do a whole lot of advocacy with government and also with ministries of education and ministries of health and youth development. I think the most challenging risk that young people face today is that of the HIV epidemic. In Nigeria, young people under the age of 25 are driving the HIV epidemic. More than half of new infections are actually occurring amongst young people under the age of 25. And that's been the opening place for people to begin to say, let's address the issues of young people's sexual and reproductive health. The issues also relating to unwanted pregnancies, unsafe terminations as a result of pregnancies not wanted, also are huge. Over 60% of cases of complications from unsafe abortion reported in Nigerian hospitals are amongst adolescent girls. In fact, in literature, 10, 15 years ago, this was described as a schoolgirl's problem, meaning a girl in school gets pregnant, the first thing she's going to try and do is, I'm terminating this pregnancy. Researchers characterize that problem, and it's still an ongoing problem. The HIV epidemic also affects girls disproportionately. For every one boy in the age bracket of 10 to 24 who is HIV positive, there are 3 girls who are HIV positive. So these are major issues confronting young people. And for girls too, the issue of sexual violence is huge. It goes largely unreported, but it's occurring at epidemic levels. So there's need to address these issues in more concrete ways. There's a whole lot of silence, which has been the case anyway from a very long time ago. There's a whole lot of silence about acknowledging young people's sexuality. Adults would rather think, they're not, they want to believe they shouldn't be sexually active. So attempts to provide access to education or services is hugely resisted by practitioners who should be doing this. And that's part of the work that organizations like ours has been doing. Fortunately, in 1999, which is like now 12 years ago, we, with advocacy with the Ministry of Education, non-governmental organizations led by Action Health, got the government to approve a policy ensuring access to sexuality education within the school curriculum. In 2002, the curriculum was developed and government gave directive that this should be implemented in schools across the Federation. It's now called the National Family Life HIV Education Curriculum, and it's in use in schools across the Federation. However, there are challenges with that. There's limited resourcing of programming, teacher training, access to text materials for students to use, routine monitoring and evaluation so that feedback from that process can be used to improve programming. A lot of the work that's been done is really been international donor organizations supporting government. Only a few state governments have committed to the process of getting this, happening within the school setting. The same thing in the context of youth-friendly service provision. Many providers aren't comfortable with young people coming in to access services. And once the young people sense that that's not happening anyway, they're not going to go in that direction. So there are really issues that much of it is driven by the limitations and barriers that are hanging out there because of adults, disposition to young people accessing services. Of course, there are issues around cost and, so there are a whole range of issues that truly need to be addressed.